Hi, I'm Lee Gorowski, and I worked with Jason Perry on a review of the cognitive behavioral theory. We're going to start talking about Albert Ellis, who was the grandfather of this particular theory, and he developed REBT therapy, which is short for Rational Emotive Behavioral Therapy. It is a short term, brief therapy. It is psychoeducational, so the client is learning new thought processes as well as behaviors. And it involves homework that the client does in session and out in the real world to kind of change how they process these events. It's a cognitive restructuring and a constant monitoring of one's self-talk. It also stays in the here and now, so it's very present oriented. There's not a lot of delving into the past unless it's going to help with dealing with that current moment and the issue that's presented. As you see in this diagram, Ellis developed an ABC framework of his REBT theory. A stands for the activating event. B are the beliefs that affect how we process that event, and C is the emotional and behavioral consequences from this system. He goes on to add D, E, and F is how he intervenes. D is the disrupting intervention, and that's the method that's applied to help clients challenge their rational beliefs. E is the effect, and F is the new feeling that's created by this disrupting intervention and the change in the client's beliefs. I found it very insightful and interesting that Ellis developed his theory in part from the ancient Greek Epictetus, who stated almost 2,000 years ago, "People are disturbed not by events, but by the views which they take of them." Aaron Beck's cognitive therapy differs from REBT and Ellis in that it is less directive and more collaborative with the client. The counselor uses the Socratic method, open-ended questions they pose to the client so they can come to their own conclusions and their own definition of their core beliefs and issues that they're having. It is all about restructuring distorted beliefs to rid of anxiety, depression, and a host of other presenting issues. It's also focused on the here and now. It's brief and time limited, and homework is also a core part of the method. Beck also came up with the depression inventory, which is still used today. Donald Meachenbaum's cognitive behavioral modification is all focused on a client's self-verbalizations, your internal dialogue and negative self-talk, changing those so you can change how you behave and how you feel. He believes behavior change comes in 3 phases: self-observation, phase 2, starting a new internal dialogue, and 3, learning new skills. One of the best coping skills that interested me was stress inoculation. I really just love the way that sounds, and I think I will be needing that during grad school. However, it does have a lot of different components to it. Information giving, Socratic discussion, cognitive restructuring, problem solving, relaxation training, behavioral rehearsals, self-monitoring, self-instruction, self-reinforcement, and modifying environmental situations. So it can be a combination or use of all of these techniques to help a client cope. And this is more of a self-help where you're teaching the client how to move on without you quickly and deal with life stresses and anxieties. It's been used for alcoholism and all sorts of behavioral issues and problems. Reorganization of one's self-statements will result in a corresponding reorganization of one's behavior.